Our bones are more than just the hard, white structures we see in Halloween decorations. They're living, dynamic organs that play essential roles in our bodies. Bones provide the framework that supports our bodies, giving us our shape and allowing us to stand upright. Imagine a building without beams and pillars; it would simply collapse. Bones also protect our delicate internal organs. The ribcage shields our heart and lungs, while the skull safeguards our brain. This protection is crucial for our survival. But bones do more than just provide support and protection. They are also involved in movement. Muscles attach to bones by tendons, and when muscles contract, they pull on bones, creating movement. Every step we take, every time we reach for an object, it's thanks to the interaction between our bones and muscles. The journey of bone formation, known as ossification, is a fascinating process that begins early in our development. There are two main types of ossification: intramembranous ossification and endochondral ossification. Intramembranous ossification is like building a structure directly from the ground up. This process forms flat bones like the skull and clavicles. Mesenchymal cells, a type of embryonic connective tissue, differentiate directly into bone-forming cells called osteoblasts. Endochondral ossification, on the other hand, is like creating a mold and then replacing it with bone. Most bones in the body, including long bones like the femur and humerus, form through this process. Initially, a cartilage model of the bone is formed. This cartilage is gradually replaced by bone tissue over time. Just like a map helps us navigate the world, the regional classification of bones helps us understand the organization of the skeleton. The human skeleton can be divided into two main regions: the axial skeleton and the appendicular skeleton. The axial skeleton forms the central axis of the body, providing support and protection. It includes the skull, vertebral column, also known as the spine, and thoracic cage, ribs and sternum. Imagine the axial skeleton as the core of our body, around which everything else is arranged. The appendicular skeleton, as the name suggests, comprises the bones of our appendages or limbs. This includes the bones of the upper limbs, arms, lower limbs, legs, and the girdles that attach them to the axial skeleton, pectoral girdle for the upper limbs and pelvic girdle for the lower limbs. Bones come in various shapes and sizes, each tailored to its specific function. This has led to the functional classification of bones into four main types: long bones, short bones, flat bones, and irregular bones. Long bones, as their name implies, are longer than they are wide. They act as levers for movement and provide support for our limbs. Examples include the femur, thigh bone, humerus, upper arm bone, and phalanges, finger and toe bones. Short bones are roughly cube-shaped, providing support and stability with limited movement. The carpal bones in the wrist and the tarsal bones in the ankle are prime examples of short bones. Flat bones, often thin and flattened, serve as points of attachment for muscles and protect underlying organs. The sternum, breastbone, ribs, and scapulae, shoulder blades, are classified as flat bones. Irregular bones have complex shapes that don't fit neatly into the other categories. They often have specialized functions. The vertebrae, which protect the spinal cord, and the ossicles of the middle ear, involved in hearing, are examples of irregular bones.